Hello, today we're here to talk about ethical dimensions of the advanced practice registered nurse. When we think about ethics in nursing, we think about morals and treating others the way they want to be treated. The American Nurse Association defines 9 code of ethics that are followed by nurses caring for patients. In 2015, the American Nurse Association revised the code of ethics, and now it includes interpretive statements that form a guideline to the standards that are held by the nursing profession. It's important that all of the nurses stay up to date with the rules and regulations. And from that standpoint, we enclosed a link of the updated Code of Ethics from 2015 and also listed out the 9 provisions with interpretive statements below. But due to time constraints, we're not going to read over them, but please feel free to familiarize yourself with them if you don't already know them. But if you look at this PowerPoint, we think about ethics and we think about just what these things say: evil, decisions, morals, life, questions, choices, wrong and right, good and bad. So we're just going to dive into ethics and what's the difference between ethics for nurses and advanced practice nurses. That brings us to this slide here. This is about advanced practice nurses' ethics, and they do differ from staff nurses. Just as advanced practice nurses need advanced education, expert practice, and specific competencies to fulfill their duty as a health professional practitioner, the same is expected when it comes to ethics. The foundation was laid for ethics already, but we need to expand on that from being a novice nurse to a practice-based nurse, and that's when we come into bioethics. Bioethics is a learned ethical form of practice, and you learn it from experience and paying attention to your decision making. You use theories of ethics. Hasted's symphonological bioethical decision-making process is depicted here in this PowerPoint, and it helps as a guide when you're trying to learn about the intertwinings of ethical dilemmas, because you're going to face them every day. It's patient-centered, and it's an agreement between the advanced practice nurse and the patient, being in agreement with practice-based decisions guiding your practice. There's 6 implicit agreements in this bioethical standards, and you see they interconnect here. When you go to talk about healthcare professional patient agreement, you've got the autonomy, objectivity, freedom, beneficence, self-assertion, fidelity, and the decision, and it's all wrapped around the context of awareness, context of situation, and context of knowledge. What kind of ethical dilemmas are unique for the advanced practice nurse? There are several unique situations for nurses in the advanced practice. Patient freedom versus nurse control, convenience versus patient's welfare, moral distress, honesty versus information are just a few examples. Patient freedom versus nurse control is when you have the patient is centered and the patient has the ability to make their own decision regarding their care. Convenience versus patient welfare. There's times when it's easier to treat one way with one regimen, but is it best for the patient? Are you doing that because of time constraints? There's ethical decisions involved there. An example of that would be prescribing antibiotics to a patient with a viral infection just because the patient's wanting something for their ailment now, and they're not understanding that the virus takes its course and the antibiotic won't work. So under this time constraint, you just rather write the prescription and it's just easier. Then you set that patient up for some antibiotic resistance in the future. A good example of an ethical dilemma would be a patient requesting treatment for pain. They want opioids and they have an addiction, and it's not for pain relief. So is pain the perception of what the patient says it is, or is it what the advanced practice nurse says it is? With ethical dilemmas, we have health policy changes all the time, constraining the way that care can be accomplished. If we have scarce resources and the pressure is there to do the most with the little possible. We also have confidentiality, informed consent dilemmas, prescription drug costs, conflict with personal relationships can arise in healthcare settings. So just working together as a team toward a common goal can definitely make a big impact on the patient's health. So in order to offer patients the best health care, we have to be collaborative and offer safe, effective, patient-centered care. Some of the resources available to resolve some of these dilemmas would be looking at the nursing code of ethics that we have as a foundation to the core nursing principles, ongoing education, quality improvement, and patient safety committees, physicians working with advanced practice nurses and not against, and family conferences. By including patients in the plan of care, you're offering them the best of care. You're putting them at the center and you're collaborating with them so you can have agreements, and that makes for the best outcomes. The American Nurse Association has online continuing education options available to nurses, for critical care nurses. There's 4 A's to rise above moral distress, and it's a guideline to manage administrative and clinical ethical dilemmas. And the first step is to become aware there's a problem, and the second step would be to affirm your role in addressing the problem, any moral distress, assessing and analyzing the risk of doing right, and then the last step is to act. Counseling can be beneficial, and it's offered free to employers. Employer assistance programs can offer help to employees for a variety of personal and work issues that may affect their ability to function ethically. There's also ethical committees that are great resources and available when you're hit in tough situations. When it comes to health disparities and ethical issues, we have to consider healthcare. Is it a privilege? Is it a right? There's an ethical dilemma right there. Some people feel that healthcare is a privilege. Some people feel that it's a right. Different countries, Canada, feel like it's a right. And the government, it's paid through taxes. Everybody has the right to healthcare. And here in America, it's whether you pay for it or not. So healthcare is not guaranteed for every individual here in America. It's argued that the cost of universal healthcare could be astronomical and impractical. And that's one of the derivatives of somebody not having health insurance. Healthcare, they have a right. Is it a moral right? Is it, should somebody be subjected to bankruptcy or suffer ill health due to lack of access to healthcare? So what side do you face there? I just had an ethical issue. Just recently, I switched jobs and 30 days without insurance. So of course, that's when things happen. Kids get sick. Do you try to ride it out? And they get worse, and then you take them in, and it costs thousands of dollars because I didn't have the money for COBRA. And quite frankly, the day you change jobs the day you lose your health care, and you can't get health care for 30 more days. So it was one of those impacts of a health disparity, so I thought that would bring into light this particular issue, because it's happens every day. Do you want your child to suffer? Do you want your family member to suffer? Do you suffer just because you can't afford health care with or without insurance? So how do ethical issues impact health disparities? You have the contractarian, which is a social contract theory. Health disparities are just morally unjust. You got the Cadian theory, it's duty-based. We're all equal, but some more equal than others. And then we have the utilitarian, its consequences determine right or wrongness. The good of many outweighs the good of an individual. So if the balance of happiness among the greater is better than comparable to unhappiness of one person. So these are just some arguments about ethical theories to support closing the gap with disparities in health. In Jones 2010, she states, recognizing that health disparities are a moral wrong that need to be addressed is another step in the moral evaluation towards fairness and equality of opportunity in our society. An example of that would be infant mortality rate for non-Hispanic Black women is 2.4 times the rate of a non-Hispanic white woman in 2007. Why is that? Any disparity in health violates the code of ethics for nurses with interpretive statements, which notes the need for and the right to care for health for healthcare is universal, transcending all individual differences. So I'm really excited about the new interpretive statements with the code of ethics. It's pretty amazing. So what is the relationship between ethics and social determinants of health? Well, that's a good question. A theory of justice argues one advantage and disadvantage in life greatly depends on chance. Other theorists argue that Rawls' theory does not take into account human diversity, and resources and means cannot be good in their own right. They have no intrinsic value. The reason this relationship between ethics and social determinants of health is so complex is largely due to fundamental differences in beliefs between being born into advantage versus everyone in this country having the same opportunities. So what is the relationship between ethics and social determinants of health? Racial discrimination is increasingly recognized as an important contributing factor to health disparities among non-dominant ethical minorities. There is a direct correlation between physical and psychological effects of racial discrimination, stress, anxiety, hypertension, high blood pressure. Well, the Civil Rights Act of 1964 ended segregation in public places and banned employment discrimination on the basis of race, color, religion, sex, or national origin. Unfortunately, racial discrimination did not end in 1964. Berger notes that effects of racial discrimination are responses that are mediated through increasingly well understood neurobiological mechanisms. More research is conducted in the area of discrimination and health disparities. And so the discussion surrounding these relationships between ethic and social determinants of health is a continuing process. Ethics also involves principles of interprofessional services. That includes ethical knowledge and core ethical principles, beneficence, non-maleficence, autonomy, justice, professional values. They form basis for principles included in the Code of Ethics. Patient safety, data validity, truthfulness, compassion, dedication to your professional role. Those are ethics. The ANA shared underlying ethical and justice-oriented principles, mostly human dignity, access to healthcare, and commitment to a relationship. These are all interprofessional services. Ethic education is important for evolving ethical organizations to help prepare future nurse practitioners to better address ethical challenges and that they face as for providers, as they are care providers. They have to build and learn how to incorporate these new interprofessional services into their practice every day. And it's something you have to learn and gain through experience. So what are some of the key qualities that an advanced nurse practitioner should have? Accountability, responsibility, autonomy, being a leader, being able to make ethical decisions, and being very knowledgeable. These are just some of the qualities that are highlighted that the nurse practitioner has to have, and that creates a competent ethical decision maker. It's important as an advanced nurse practitioner to be part of the interprofessional education, cohesiveness with other team players in the health industry, to work together cohesively for the good of the community and the good of your patients. And that coming together as a team and having the patient-centered care gives the best, highest quality to your patients and your community. Some of these team members, just as an example, could be a chaplain, nurses, physicians, therapists. They all come together and they can discuss ethical values that arise with patient care. What are some of the ethical dilemmas? We talked about some before, but some of the bigger hit ones we're seeing are like the end-of-life care, life-sustaining treatments, cultural or religious differences. So this interprofessional collaboration has a perspective where all the persons involved are in the process of making the decision. That ensures for the highest quality of care given without bias being set. So it's really important. There's 4 core competencies that involve IPEC and that effectively enhances team function, helps organize and share information with patient families and healthcare providers. With the core center being the team and having the core competencies, and then it branches to where you've got roles and responsibilities, teamwork and processes, communication and value and ethics, and they're all going towards the team. So the team is the center, and everybody does that and takes those roles in the teams and the values and communicates to create that core sharing of information and working as a team to organize and share this with the patient and families and healthcare providers. So. And I just want to point out too, when you're talking about IP communication, you're either 2 or more individuals coming together is all that it takes to form that team as well. One of the most basic elements of human interaction is the ability to communicate. Communication, particularly in high-intensity environments such as healthcare, is not merely the transaction of words. Tools to elicit effective communication are active listening, know intent of the message, foster a safe environment, give accurate information, speak to the right person to get the right information. Nurses cultivate caring relationships with their patients while supporting them with their physical, mental, and spiritual needs related to health. There's principles that guide nurses to use developing interactions with others and to cultivate caring relationships. You have to be true to yourself. You have to empower others. Recognize strengths. Be 100% honest and respect others' personalities. A well-developed environment supports great nursing care. Nurses gain satisfaction knowing that their work is valuable and meaningful. And the principles allow nurses and others to thrive and succeed at their work because they're not afraid of failure. Inspire, innovate, and creative thinking. Evaluate, improve, celebrate, create a culture of safety, share knowledge, question the status quo. These are all conceptions of collaborative relationships. It's great, effective communication. It authenticates relationships and it creates a learning environment and embraces culture. Teamwork is where it's at. It's truly the heart of interprofessional practice. Teamwork is a result of quality interactions among professionals from different areas and involves a recognition and handling of conflicts. Accomplishing interprofessional collaborative teamwork is essential for healthcare quality, safety, and patient and job satisfaction. It's truly the mutual respect and professional bonds and collaboration, trust, communication, teamwork makes dreams work. When ethical dilemmas arise, what does an APRN do? It's important that the APRN facilitate resolution when faced with an ethical dilemma. They should practice autonomy, justice, beneficence, non-maleficence, beneficence, in order to produce positive goals, decisions, and ethical judgments. Just a review on autonomy, as a role, an ethical dilemma, we are advanced practice registered nurses, and autonomy is huge. It's allowing decision-making to be an independent choice, and it's also allowing patients to be the primary decision maker without coercion. Justice, to understand that not all patients share the same beliefs. That's why it's do unto others as they want done to them, not do unto others as I would want them to do unto me, because I might want something different than that person. That one was a tough one for me at times. Everyone is entitled to receive health care regardless of their color, their race, or their religion. The advanced practice registered nurse has a responsibility to uphold justice with their patients. They're obligated to provide culturally competent care and also being aware of the cultural beliefs in order to provide competent care and culturally sensitive care. Beneficence. Treating the patient without harming the patient. That's a big one. Are we so rushed in our care that we're not taking the time to make sure that we're not harming them, intentionally or unintentionally? The APRN should always do what's deemed appropriate to keep patients free from harm. It's that practice of ensuring that the patient is heard and that their wishes are not only considered but are acted out as well. Beneficence aids in the patient maintaining their dignity in all situations. Non-maleficence ensures that the benefits are always outweigh the risks involved at all times. So you treat with the least amount of harm with the most favorable outcomes. Ethics. Close your eyes for a minute and just take this in. It's a quote. The noblest action a nurse can take without justifiable action is possible is her act of accepting her patient as a human being as real as she is, unquote. Yeah. So again, the noblest action a nurse can take without justifiable action is possible. Is her act of accepting her patient as a human being, as real as she is. We see patients day in and day out. They just become a number. You know, you have to sit there, that homeless person that's got nothing, that's a human being, has feelings. Want to close just with this one video. It's a YouTube video, and it's a fictional demonstration of an ethical scenario to ponder.